1 year ago, the coronavirus was largely a mystery. China says the virus's ability to spread is strengthening. That sounds dire. What does it mean?
It's unclear exactly what they mean by that.
That was last January, one day after learning of Canada's very first case. Since then, infectious disease doctors have spent hours answering our calls and answering your questions. Some have become household names, from Dr. Isaac Bogoch in Toronto to Dr. Lynora Saxinger in Edmonton.
We really have to up our game in terms of the prevention of transmission in the community.
A year after the first case was confirmed in Canada, we want to chat with them about what we've learned and how the pandemic has changed their lives. Welcome to both of you, and Dr. Bogoch, who knew when we had that first chat so long ago that I would keep seeing you over and over and over again. How did you decide to take such a public role in talking about COVID?
Well, it's very interesting in that obviously this has impacted Canada and the world, and there were so many questions. And quite frankly, we're in an era where there's a lot of misinformation amplified online, and it is wonderful being part of a much larger team of healthcare providers and scientists that really helps the general public understand this a little bit better.
And Dr. Saxinger, you've answered every one of our calls. Was it difficult at all to making the decision to be so public about COVID?
Well, I mean, clearly there's some downsides to putting yourself out there. You do get some feedback, and I've learned never to read the comments. But I actually do agree that, there's a sense-making function that's important. And when people are under stress and there's information coming fast and furious, it becomes even more important. And I think that's evolved over time. Now it's more like trying to help people understand why there's differences of opinion. And it's become a very interesting landscape as time has gone by.
Yeah, and so Dr. Saxinger, I follow both of you guys on Twitter, but Dr. Saxinger, I remember at one point you wrote how you're very reluctant to make public comments about masking because it's so controversial. You just mentioned you've stayed away from the comments on Twitter. What kind of feedback, though, are you getting sort of in your day-to-day life?
It's interesting because I guess I now realize how many people watch the news, because I feel like people feel like they know me. And I've had quite a lot of really nice interchanges with people who are just saying, thank you for the information, thank you for presenting in a way that I find easier to understand. And that's been actually very valuable to me, and hearing what people really, how they react to things, I think has been really useful to me as a communicator as well. And
Dr. Bogoch, same thing. First of all, both of you guys are your doctors, your parents, your spouses. I don't know if you have time to lead a normal life, Dr. Bogoch, but if you are at the supermarket, do people tap you on the shoulder there?
Yeah, I mean, I think I've had a similar experience as Dr. Saxinger as well. You get the odd nod, the odd smile, the odd very, very kind comment, and it's wonderful to see. But full transparency, I mean, since the pandemic really started in Canada, at least in March, I mean, I haven't led much of a life and had many opportunities to have social interactions. I sort of live between the house and the hospital. But when I do venture out, which is unfortunately rarely, it's very nice to see the odd, very positive comment here and there.
One of the things about our knowledge of coronavirus is that it is evolving, and one of the things I appreciate with both of you and your colleagues is that you are willing to speak publicly, even though you know that what you say today may not represent kind of the state of science in a month's time. I want to ask you both this, but Dr. Saxinger, I'll start with you. Has anything kind of stood out or surprised you about the way our knowledge of coronavirus has evolved?
Well, I think the thing that has become more and more clear is that, there's early signals that this virus could be transmitted very easily and very early in people with very minimal or no symptoms. And I think it's more often minimal symptoms, though. And how that's manifested has really been fascinating, because it tells us where people are interacting in society and where they don't have a choice in terms of, avoiding certain types of interaction. And to me, it's illustrating a lot about our societal function that I think we can learn a lot from, especially if we want to prevent things like this from happening in the future.
And Dr. Bogoch, what's struck you as our knowledge has changed in the last year?
What's interesting is when we chatted about a year ago, we were talking about fever, cough, and shortness of breath as the symptoms. But as we learn more and more about this virus and have a much better understanding of the true clinical manifestations of it, we clearly see that it's much more broad than that. And some very interesting signs and symptoms like loss of smell and taste. That's kind of bizarre, and I don't think anyone would have predicted that from early on. So there's been some really interesting clinical manifestations that we've found from this infection I find fascinating that just evolved over time.
We could all use some optimism, particularly some informed optimism. So here's my challenge for both of you within 30 seconds each, starting with Dr. Saxinger. Is there cause for optimism?
Absolutely. I mean, we've learned a lot. This is a chess game. It's not a single battle. And the fact that we already have really good vaccines is incredible. We just have to deploy them right and make the right moves over the next several months. But I really think that we're moving into an endgame stage, and that we'll be able to plan for the future better.
Dr. Bogoch?
I'm completely in agreement with Dr. Saxinger. We're in the vaccine era. There obviously is a shortage of these vaccines right now, but as we move into second quarter and we watch this vaccine program massively expand, I think we're going to start to see some real significant benefits that actually manifest into a positive change in our lives in terms of how we live. And I don't think we're going to go back to 2019 like that, but we're going to start moving along that spectrum rather quickly as we move into the spring and summer.
Have you guys ever met each other, by the way?
Not in
just
person.
On this
I just see you here.
Venue.
All right. Well, hopefully I keep thinking hopefully post-pandemic there'll be a big infectious disease doctor party, and I can be there, and we can sort of have everybody chatting in the same room. But for now, thanks for sharing a screen. Thanks to both of you.
Thank
Have a
you.
good evening.